Hello everyone, my name is Nataly Barajas. I will be today's presenter. I did my needs assessment based on a need that I found within my own imaging facility, and that is better communication, better interdepartmental communication within my own facility. So the objective is to evaluate and improve communication between all departments within the imaging facility. I have noticed within the past couple months that there has been a breakdown in communication amongst all the departments, whether that be between the technologists and the front and back office staff, technologists, the management, and the office staff. There's just been a slow trickle down effect of communication being lost. Another objective is to identify the gaps in what is causing workflow to break down, and to recommend improvements that can possibly be implemented to help this breakdown in communication. So, the populations that were identified. Number one is the radiologist. He is the one, or they are the ones that interpret the images for us and create the results and communicate the findings to either ourselves or mainly to the referring physicians. Next population would be the imaging technologists. We are the ones that perform the exams. We are the ones that are speaking the most with the patients, other than front and back office staff that are scheduling and or checking in these patients. We are the ones that the patients will speak to and tell any additional information that maybe the radiologist needs to know. Next one down is the front office staff, which would be receptionists, the ones that are checking in the patients, and scheduling staff. They are the ones that are getting the first round of information. That would be the scheduling staff. They are the ones that provide us with the first overview of the patient and what they need. Along with the receptionists, when they get there, they're the ones that are supposed to be prepping the patients a little bit and making sure that we are getting any additional information that may be vital before we bring the patient back to have their scan done. The next one would be the referring physicians. They are the ones that are sending us the orders. They are the ones that are providing us with the instructions on what the patient needs to have done, whether it be an MRI, CT scan, ultrasound, DEXA, anything else, and then of what body part is needed, what laterality, if there's anything specific that they want, a certain type of contrast within the imaging, whether or not they receive oral or IV contrast. That is very important for us to communicate well with them. And then finally, the facility managers and department heads, more supervisors than department heads within this facility. They are the ones that oversee everything operation wise, whether or not everything is flowing correctly, if staff is getting along, so on and so forth. Priorities and importance. Our number one priority is always going to be patient safety. And their patient experience. Safety over experience, however, those should go hand in hand no matter what. Operational efficiency is also very important. If one thing happens at the beginning of the patient's stay with us or the patient's time with us, then it's going to trickle down so that way it affects anything else. It is very important that we get everything down to the T before it gets out of hand and it spirals. Compliance and risk reduction, that is very important to make sure that we are following every safety precaution that we possibly can and we're complying with any rules and regulations that are placed upon us. Employee morale, super important. If morale is down, patient care is going to be down, patient experience is going to be down. Technology integration. If one person isn't able to fully use any technology that is implemented in the facility, it's going to backlog everything and it's going to trickle down to where, if it's someone in the front office staff that isn't able to figure out how to use the scanner if it's new, or import a certain document that the technologist needs, that's going to affect workflow, operational efficiency, patient experience, patient care, all the above. The patient experience, like I said, patient experience and patient safety go hand in hand. The problems that I identified, as I said earlier, delayed communication in general, but one of the main things that we're having issues with is delayed or incomplete imaging orders. We have been getting many orders that the doctors just aren't being specific enough on what they need. Main problem with that is that the schedulers are getting these orders and not questioning anything. They are simply just slapping it on the schedule and hoping that it's going to work out. And 9 times out of 10, it doesn't. Ends up pushing everyone back a little bit because we're trying to figure out what's going on. Breakdown in patient handoff, that is from the front office staff, the receptionists, that are then handing the patients off to us once they are checked in. There is some prep to go in, especially if it's a CT exam, whether or not they need oral contrast or IV contrast, if they need to start an IV. If it's an MRI, patients need to change out. Sometimes the receptionist will tell the patients, oh no, you don't have any metal, you're totally fine, you don't have to change, when in reality, there is a woman who has a bra that has underwire and clasps on the back that are going to affect and throw off the images completely for an MRI. Radiologist and referring physician disconnect, that's conflicting ideas between what's going on between the two doctors. Secluded departments with little interaction, that's delayed or complete lack of communication between departments. Whether mostly it's technologists and management. Management thinks that it's very easy to simply just place as many exams on a schedule as possible. Not the way it works. Opportunities. There needs to be a standardized communication workflow. There needs to be, standardized communication, whether it be team huddles or a specific tool on the computers that helps us communicate with each other. Implementing trainings to ensure safety protocols are being followed and needed. Feedback, whether it be suggestion boxes or meetings directly with the management, that's also very important. So the survey results. I did conduct a survey as per the instructions of the assignment. There was multiple questions, but the main one I wanted to focus on was the statement, I believe leadership encourages open communication. This was ranked on a scale from 1 to 5, 1 being strongly disagree and 5 being strongly agree. The two groups that were surveyed were 3 lead technologists and 3 managers/supervisors. It is very clear that there is a strong disconnect because all 3 managers stated, and on the survey they stated that they strongly agree with this phrase, with this prompt, while the 3 technologists strongly disagreed. That is a huge discrepancy, and that was actually a common theme amongst the whole survey. So that's a little bit concerning. Next steps. So we really need to continue to survey the staff, not just the lead technologist, but the staff in general, the other technologists, the staff in the front, staff in the back. And those results need to be presented to management so that way they can see that there is a huge discrepancy in perception of communication. That is exactly what the focus groups would be needed for as well. We do need a better communication plan, and we need to evaluate how things are going. So that is the presentation for my needs assessment. Thank you very much for your time.